The patient presents with normal ABGs. The pH is 7.36. That's within normative range, which is between 7.35 and 7.45. Their PaCO2, 4.8. Normal is between 4.6 and 6.4. PaO2 is 12. Normal is between 11 and 14.4, as well as their H2CO3 is at 24. Normal range is between 22 and 28. So ABGs are normal. When looking at the chest x-ray, um, there were no broken bones. As well, there were 6 anterior and 8 posterior ribs counted. So typically we're looking to see 8 on the front and 10 posterior ribs. Sorry, 8 anterior and 10 posterior ribs. So this could indicate a little bit of hypoinflation. Also, when looking at the X-ray, the cardiophrenic angle appears irregular. The heart potentially is a little bit small, which could also indicate volume loss. Also, the diaphragm, when looking at the diaphragm, it looks like there's potential reduced volume because the right side of the diaphragm is typically pushed a little bit higher than the left. It appeared that it was reduced, so that could also indicate volume loss. When looking at the fields, there appeared to be some increased sputum retention bilaterally. There was, it looked to be in the bronchioles, similar to a bronchoectasis pattern. There was a gastric bubble present, as well as the helia appeared to be normal shape in the correct position, and there was an electrode visible as well in the chest X-ray. The patient is a 14-year-old female, presents with an exacerbation in her cystic fibrosis symptoms. She reports sleep disturbance 3 of the last 7 nights due to her coughing, as well as reduced airway clearance at home. This is her 4th admittance this year. She was diagnosed with cystic fibrosis at 4 weeks of age. She's currently taking she's taking a medley of prescribed drugs. She's taking some antibiotics, some meds to combat COPD symptoms, improve mucus clearance, pancreatic enzymes. That sums most of them up. She currently lives with her parents, but has recently changed schools because of bullying at her past school. Could indicate some potential psychosocial symptoms she's exhibiting as well. She has new friends, possibly engaging in risky behaviors from peer pressure. She's admitted to drinking, but denies smoking, and has also not told her new friends that she has cystic fibrosis. Also, she has reduced activity because her friends don't want to participate in the same activities that she did, in particular swimming. From observation, she's reluctant to chat. There are crackles in her right mid-zone. She suppresses her cough. Assume that might be due to being embarrassed. There are a medley of reasons that could cause that or influence that. Her cough is productive with MP3, which is synonymous with cystic fibrosis. X-ray presents secretions throughout the central and peripheral airways, as well as slight underinflation from the ribs. The cardiophrenic angles are irregular. Her respiration rate is 16 to 20 breaths per minute. That's normal, as well as her SpO2 is 97%. She has a normal temperature and normal blood pressure with 110/80. And the temperature is 37.5 degrees Celsius. To put my list of physiotherapy problems in order, I would rank them number 1 being sputum retention, number 2 being exercise tolerance, number 3 being volume loss, and number 4 would be psychosocial problems that the patient exhibits. So just going to talk about them in order in regards to sputum retention. Reason I know this is a problem is because there were palpable secretions in her right mid-zone, as well as crackles were heard upon auscultation. X-rays also indicate secretions through the central and peripheral airways. Exercise tolerance. This is kind of assumed that it's reduced due to her lack of exercise and lack of interest in exercising due to her new friends. So it's just kind of assumed, but taking into consideration cystic fibrosis exercise is going to be beneficial to help mobilize secretions, which is the first problem I've ranked on my list. Sorry, for number 3, the third problem I've identified as volume loss. Again, this is also assumed due to the chest X-ray. We only see 6 anterior and 8 posterior ribs compared to the 8 and 10 that we would typically see. Cardiophrenic angle seems blurred. That could indicate volume loss as well as I said before, the diaphragm looks a little bit potentially deviated, or it doesn't look normal. It looks irregular. So that as well could indicate some volume loss. And fourth and finally, psychosocial problems. So she mentioned that she was bullied, potentially participating in risky behavior as well. She's admitted to drinking, hasn't admitted to smoking, but there is some peer pressure there, as well as lack of exercise participation. That could be a psychosocial problem because of the new friend group. They don't find it cool, or just aren't interested. They have other interests. The pathological process of cystic fibrosis starts at birth. The patient has delta F508, which means she has a deleted phenylalanine. So essentially, this is there's a mess up in folding of amino acids into proteins, and that's what makes the calcium ion or the chlorine ion channels. Also, cystic fibrosis is autosomal, comes from one of the first 22 chromosomes, and also you have to have 2 defective copies of the same gene on chromosome 7, so you get 1 defective copy from each parent. To talk about the cycle of how cystic fibrosis affects the pathology of this specific patient's respiratory system. So the bronchi fill up with mucus due to decreased mucoclearance and an increase of mucus production, especially thick, dry mucus. This causes chronic inflammation and damages bronchiolytic lining. While this happens, people with cystic fibrosis also have a A1A deficiency or possible A1A deficiency, which essentially during inflammation the neutrophils release elastase, and A1A stands for alpha-1 antitrypsin. It blocks the activity of elastase, so it can't break down the elastin in the bronchioles and bronchi. But because you're deficient in that, the tubes dilate and become stiff as the elastin breaks down, causing the bronchi to fill up with more mucus. And because the mucus is dry and thick due to the chlorine ion's inability to be absorbed into the mucus, the cells absorb water through osmosis. So the water is sucked out of the mucus, causing it to be more dry, therefore more difficult to mobilize and move. After examining the subjective and objective data, come up with some psychosocial, age, gender-related problems that could be affecting the current presentation. First of all, patient is 14-year-old female. At the age of 14, potentially starting to go through puberty. I know in cystic fibrosis, females start to mature a little bit later due to cystic fibrosis. This unfortunately is a non-modifiable risk factor. Also, um, females have thicker cervical secretions. So things like this just could weigh on her mind, cause some psychosocial, maybe depression, anxiety. That's why she may be looking at more risky behaviors. Also, males typically have a better outcome up to the age of 20 in cystic fibrosis. So, not really knowing what she's fully going through, she could be subject to just having a worse time than males potentially. Um, Cystic fibrosis is also more common in Caucasian population. Um, After looking at the subjective, says her parents they have good jobs. Dad is a surgeon, mom is an ICU nurse. I'm assuming they have a higher socioeconomic status. Taking that into consideration, the patient does have a lower risk of death due to because they have a higher socioeconomic status. However, at the age of 14, also considering she's probably understanding the pathology and how it progresses of cystic fibrosis, so that could add some additional stress. Just understanding that she may have half of her life left to live could weigh a lot on a 14-year-old. Speaking of some psychosocial, taking into consideration she was bullied, that is a non-modifiable risk factor. But with new friend group and risky behavior after being bullied, she could be prone to, as said, partaking in risky behaviors. This, of course, is modifiable. She could look for new friends. She could look for other things to do with her time. Also, decreased physical activity. That could be a way she takes away from time she spends with the new friends. Potentially, there's associated low self-efficacy, depression, anxiety, and of course, suppressing her cough is all modifiable. But this all could relate to some of the psychosocial factors of being bullied for having cystic fibrosis. She's trying to mitigate her coughing to make it seem like she's not that sick. It's causing, again, low self-efficacy, depression, anxiety.